Hi guys, we're back. How did you all get on with that movement competency screen? I hope you found it interesting and perhaps some of you identified areas where you can improve a little bit, or maybe you discovered you've got slight impingement somewhere and now you're seeking alternative therapies or remedies, or really looking at your training patterns and ways that you can enhance your training and working on those areas. So I hope you found that interesting. It's not something you need to do particularly regularly. It's just a nice place to start, and then you can keep going back to it as you progress your training through the year, just to see whether you are, feeling the benefits of better range of motion and so on.
Yeah,
so,
it's
yeah.
good.
Yeah.
Right, well, I hope you guys did really take a lot away from the last video, and what we're going to be doing this week is we're talking about posture. Everybody, has a question. Is my posture good? Can it be better? Do I need to work on it? And that's what we're going to run through in this next part of the series. I think it ties in nicely with our theme on confidence. If you feel good in yourself, you hold your posture really, really well. And if you feel confident in your posture, then so your confidence grows. And it's just got that cycle that keeps building. Posture gets affected by so many different things. Injury is quite a big one. If you've injured a certain area, you compensate around that, and that slowly starts to affect the way you hold yourself, how you stand, how you move. And there's other things that happen in life. Weight gain, that's, sometimes if we pick up a bit of weight, especially around the gut area, that massively has a big change and knock-on effect for how we hold ourselves. Pregnancy as well, weight gain we can't quite control. And so it's all these different things that we deal with in life, and if we can kind of identify any postural issues that we have, then we can improve on them, so it will help with that posture. And do you find that posture affects some of your clients when they're training? Or
Absolutely, and I think lots of the ladies that train with me are sitting at desks all day, and many people now work from home, so we don't have occupational health over our shoulders setting us up nice and ergonomically. Some of us are just at the dining table, so if you're doing that all day every day, that can have a huge impact on your posture. And so when you come to me and you train, it's very obvious for someone that is desk bound, rolled shoulders, quite restricted through the thoracic spine, which does then limit you with certain movements. So if you're pressing, you're rowing, you'll struggle to lift the weight, any sort of rotational patterns can be affected with bad posture. So it just really restricts you from getting the best out of your workout. So the more we can move, the spine, the better movement and the range of movement we will have. And obviously I'm quite on the mobility now, and I do something on a Wednesday morning, some of you join in, just in terms of moving through the different ranges of motion through the spine, working on that shoulder mobility, all of those things around posture, which are really important. So I think training is really beneficial, particularly if you do work in a job or you don't have great posture.
I think that's the movement to improve your posture. It's such a nice way that the two merge together. And if we're not moving, the postural issues we have, it just causes them to, get bigger and bigger. Well, a big thing that we use in the clinic as a chiropractor, we say, if you don't use it, you lose it. And it's so important. If we can just reintroduce that movement through training and exercises, we're going to help reduce the changes that our bodies are undergoing as we get older and as our postures develop. It has a big effect on the spine itself. We're starting to look at osteoarthritis. So these are changes that the bone undergoes due to the positions we're putting it in. The body loves to be in a healthy position so it can operate at the best level of quality, but as well as if we're moving it in the right position, we're going to get the best benefit out of it.
Absolutely. And obviously when I was having my lower back issues, I came to you, and one of the things that you did was assess my posture as a starting point to see, what we needed to work on. So I don't know if maybe that's something you want to do now and show me how you assess posture.
Let's check out Charlene's posture. Obviously we have workloads on her body, and I'm not gonna lie, posture is quite lovely, but I'll walk through any issues that Charlene might have, and also issues you might have that we're not seeing on her. That's going to be really key for you guys to focus on. So let's do it.
There we go.
Alright guys, so now we're going to be assessing Charlene's posture, alright? So when you guys are at home, I want you to take off as many layers as you feel comfortable with, or wear some really nice tight clothing when you're looking at yourself. So pop in front of a nice mirror so you can see all your details, and you're going to look straight ahead at yourself. And what I want you to look out for, first of all, is your head sitting in a straight line, okay? So sometimes people kind of cock to the side, especially if you're using a desk or you're using a lot of work on your mouse and your computer. If the head is sitting to one side, in every movement we do day to day, it's going to overload those shoulders unevenly, which can lead to neck and back pain. So first thing we want to do is have that head nice, neutral, and in the center. You're then going to drop down and see what your shoulders are doing. So we're going to look at that shoulder height. Is one shoulder dropping down compared to the other? All right. And we also want to look, are we rounded through the shoulders? This is a big thing and the most common postural thing that we see. Lots of desk work, especially kids' backpacks or handbags, anything you're wearing is going to round those shoulders forward. And again, can lead to shoulder injury or just putting strain through the muscles around the area, leading to pain. All right. You're then going to run through your chest. Again, we want to look at our pec areas. And ladies, you're going to look at your boobs, all right? You want to see, is one side kind of hanging down compared to the other? Are you rotated in your upper back? And we really want everything facing straight ahead, nice and even, okay? Next thing we're going to come through is you're going to obsess
We're
over your
obsessed
pelvis.
with the stomach, yeah.
You're going to observe your pelvis, all right? So you want to see what your tummy's doing, particularly look at your belly button. You want to see, is that belly button staring straight ahead, or are we facing one direction or the other? If it is not quite in the center, this could mean a rotation in the pelvis. Now, ladies, if you have had a C-section or you've had babies, this can also kind of mean that the belly button's not going to be in the center. That can be normal for you, but if it's coming from the hips, these are things that we can work on, all right? I then want you to run down and look at your knees, okay? Are your knees facing the mirror? We want them again looking straight ahead. If one is rotated in or one is bending in, these are things that can be improved on. But you also need to take into account injury can cause issues within the knees, and sometimes there's a few restrictions and limitations there, which we can cover in a bit. And lastly, looking ahead at your front, I want you to have a look at your feet. Are your toes facing forward? You're also going to look at the arch, which is underneath your feet, okay? You're looking for a little gap that sits underneath your foot. If you're flat on the ground, that's fine. It just means that we might need to work a little bit on those flat feet. And some people have really high arches, which can also kind of lead to a bit of ankle instability. So we'll cover that in the next few series. So once you guys are confident that you're nice, straight, looking ahead, we're then going to do the side posture. So Charlene, if you could just switch your body to the side. Okay, that's lovely. Now, when you're looking at your side, it might be a bit difficult if you're looking over your shoulder to kind of look at the different bits. So I want you guys to maybe, if you feel comfortable, take a picture of yourself so that you can go and break down the next areas of your posture. Now, the biggest postural thing we're seeing in today's day, especially with all the computer work and cell phone work, is that head coming forward in front of the shoulders. Yeah, that's it. We call it text neck. And it's something that's leading to speeding up the degeneration of the neck, which can be really difficult to undo later on in life. So getting this right is really key. So with Charlene, we want that ear sitting right on top of that shoulder, which hers sits beautifully, which is lovely. Again, as we mentioned in the front, if those shoulders are rounding forward or they're sitting in a nice neutral position. All right, something that we can all work on, just a little quick tip, is if that head is coming forward, if you chuck your chin in just a little bit, you're going to bring that head back, which will be a lot more comfortable for your body. The head is actually really heavy. So what I always say is if you picture holding a bowling ball, it'll be more comfortable to hold it right up against your body, as if holding it all the way away from your body, it would feel a lot heavier and it would strain the muscles in the arm. So to make it more comfortable for the muscles around the neck and shoulder, try and tuck that head back in. The next component we're going to look at are the hips. So Charlene, if you could just raise your arms for me. Anterior pelvic tilt is a massive issue that we all deal with, most people day to day. So what you're looking for is your pelvis shifting forward, okay? So you're hinging tight in those hips and you're just stuck in that position. This can create an array of issues, again, for the hips and the lower back. So what we want to see is that we've got a nice neutral space and a good stretched out pelvis through the front, glutes nice and tucked in at the back. We will give a few tips on how to correct an anterior pelvic tilt. And then lastly, moving through, again, you want your knees directly in line with one another. We don't want one bending and popping forward. You should always lock your knees quite nice and neatly. You shouldn't, make them too tight. Again, this could create issues with the knee later on. And again, having the ankles in a nice neutral position with those toes sitting aligned. We don't want one leg in front of the other. Again, that could mean a rotation through the pelvis. All right, you can relax your arms for me. That's a breakdown of a good posture assessment.
Fantastic, that was really nice and relaxing.
Good, no problem. All right, perfect, everyone. I hope that you guys go home and have a good look at yourself. Once you do go have a look at your posture, if you do pick up any issues you're concerned about, there's many people that you can turn to help out. For example, working at the clinic here in West Byfleet, we do a more in-depth postural assessment, and we can put your mind at ease for any stresses that you have. But anything minor you've picked up today, we've got some amazing exercises coming your way that's going to help improve that posture in our series.
Yeah, and just to conclude, so some of the things that we're going to be looking at in the future is the pelvic floor and any bladder control issues that you might have. I'm absolutely very open about my own bladder issues. I suffer from stress incontinence and I don't feel ashamed about it.
Yeah.
I've had 2 children and it's quite normal. We're going to be having a chat about that. We're going to be speaking about menopause. We might invite a few guests on to talk about their experiences. And then if there are any other ideas or suggestions that you might have of things that you want to know, tap into our knowledge and expertise, and you want to see on this little series that we're putting together, then get in touch with us. DM us.
Thanks, guys.
Yeah, have a great day. See you
Bye.
later. Bye.